Have you been told that you have bursitis? Let's talk about why the bursa may not actually be the problem. I'm Dr. Danny Clark, Director of Orthobiologics here at the Protea Performance Center. I have a lot of patients that come to me and say, hey doc, I have bursitis in my hip, super common one, or I have bursitis in my shoulder, another very common one. And, we did some steroid injections into the bursa and it's not getting better. So what a bursa is essentially a little sac of fluid that protects two layers of tendons or tissue from rubbing together. So the one in our hip prevents our glute tendons from rubbing together too much and irritating the tendons. It's like a sliding cushion essentially. And what happens is when those bursas get irritated, they can get inflamed and become painful. So the bursa itself can be painful. So that's not what I'm saying here. What I'm saying is that there's actually generally an underlying cause of why that bursa got inflamed in the first place. So if you have a rotator cuff tear or a glute tendon tear, that tear and the inflammation in that tear is then irritating the bursa, and then the bursa gets inflamed. So injecting into the bursa with steroid injections may calm that bursa down, but over time, that's probably just going to come back again until that tendon is actually addressed and healed. And so our approach here is to actually treat the underlying reason why that bursa is inflamed, like treating the tendon with PRP to stimulate some healing of that tendon, and then also putting some in the bursa as well. So we're treating both at the same time to give you the best chance at actual long-term healing of both the tendon and that bursal pain. If this sounds like something you've been dealing with, feel free to reach out to our office. We can schedule a free 15-minute discovery call and chat about your case to see if this is something that you've been dealing with and if you're a candidate for regenerative medicine therapies.